And then we have pec minor. So pec minor, we've already talked about where it lives. It's over here and it inserts into the coracoid process, and it helps the forward tipping of the scapula to where it tips forward, which gives us more leverage coming up and around the shoulders, down and around. Awesome. What else do we want to know? We want a different view. Scapula, upper limb. Let's do upper limb one.
Whoa.
Too much. Alright, so greater and lesser tubercle. Greater's right here, lesser's down here. What inserts into the greater?
The rotators?
Sit. Sit. Which ones? Supra, infra, teres minor. Lesser tubercle. Subscapularis. So differentiate those muscles by action. Which one's an internal rotator? Subscap, because it's coming from underneath. And if you imagine it coming from underneath and inserting here, it's going to pull down and in, especially if you're actually rotating. So all the greater ones are external, kind of, sort of. What do you want from me? There's no absolutes in this. Kind of, sort of. So why do I say kind of, sort of?
Supra is more abductor.
Okay, so teres minor. I'm going to rotate this guy around. Pinch you in just a little bit. So we're going to go here. We'll say teres minor is coming here. We're going to have infraspinatus coming in here. Right? So those, in this position, if you imagine pulling a string in together, it's going to pull that and rotate that arm around. Make sense? Now, supraspinatus fills that hole there, goes underneath that coracoacromial arch and inserts there. In that line of pull, does it look like it's rotating a lot of anything? Not so much. It's pretty much direct. It does abduction in the first 15 degrees. Beyond that, your deltoids take over and do the rest of the work. So when does supraspinatus get used, though? Why do we still count it as a rotator cuff? Is it rotating things?
I don't know.
Well, there's no absolutes in what we're doing, so a lot of it has to do with the position that it's in. So this is in neutral, in the direction, scaption. So if I do internally rotate it, it's going to be pulled in a little bit. If I externally rotate it, it's going to have a different leverage. So we use this one considerably on decelerating, on negative acceleration of a throw. So if you've got somebody who goes through the throwing motion, then it's working to externally rotate as my arm's coming into internal rotation. So it gets used, and it gets used a whole lot. It's just not directly obvious when you stare at it from the top. Because that first 15 degrees, we don't think about that as the majority of the motions we do with this muscle. So it does get significantly used. And then in that conversation, we also have concerns for impingement, as it's maximally firing when we're closing off that joint space. And we can talk about impingement later. Some other day, probably next week with ortho. Cool? We can revisit that world. So in through there, you can see right in through this happy little space that there isn't much space. What structures go into that or through that space? Long head, biceps. Long head of biceps brachii. Is that anywhere you were going?
Yes.
Oh, sweet. Exactly what I thought you were saying. Okay, so biceps brachii. Stop blowing too bright. Okay, so biceps brachii. That groove right there. Intertubercular groove on the head of the humerus. Greater tubercle, lesser tubercle, there's a happy little perfect groove that goes up and through there. And in that groove, lives the long head of the biceps tendon. Now there's a transverse ligament that kind of tethers it down in place as well and maintains it in location so it can't pop out and slip out and do unhappy, unwelcome things. Where does the long head of the biceps originate?
The supraglenoid.
Supraglenoid tubercle. So if I go and highlight, my joint capsule for my humerus, you can kind of sort of see it here, and I'm going to hide that away. Now what we see in here is our glenoid, right down in through there. There's the head of the humerus. So that's our articulation surfaces that we have, right? So that long head, get a good view right there, is going to slide up through that groove and then originate right off of the top part of that glenoid, which is the supraglenoid tubercle, which happens to put it underneath the coracoacromial arch, and it inserts into the same tissue that the same location that the labrum sits on. So what is the labrum? It's a cartilaginous extension of the glenoid, which deepens the socket just a touch. So we have this very significant muscle tendon coming off of this location, so we have the capacity to damage those in connection. Again, happy conversations in ortho. So through that same location, coming down into about here, we've got the supraspinous tendon, the supraspinatus muscle, right? So supraspinatus muscle, long-headed biceps tendon origin, and there's one other structure that sits in the subacromial space. What is it? A bursa, subacromial bursa. Good thing to remember that it exists. In your careers, if you stay with us, then you will see this problem. Undoubtedly. Unless you're working with, like, paintball. Sorry. No disrespect, man. Table tennis. All right. They do. They get pissy when you call it paintball. Table tennis. Whoa. Whoa. Put your paddle away, son. All right. Deltoid muscle comes off of this curve right in through here. Okay, that's a little bit of a lie. I'm going to try it again. Comes off of this line right in through here. So posterior, middle, anterior delts. All of that kind of blends together into a location right down here. What is that location? Deltoid tuberosity. What nerve innervates the deltoid muscle? Ooh, got it. Axillary. Excellent. Axillary nerve comes up and hits the deltoid. Brilliant.
That is auxiliary.
Keep your canoa to yourself. All right, so what we have from here, that gets us through the majority of our life in there, right? Pretty good? Okay, so from this point, you want me to keep drawing stuff, or you want me to go to muscles? I mean, I can keep talking muscles and draw them in and still focus on the bones, or do you want me to go to the muscle app so you can have me pull them? This is good? You like this better?
See the attachment.
So you can get rid of them as we go. Done. All right, so coracobrachialis we discussed, comes right in through here. What's its job? What's its role? What's it do?
Abduction. No.
Say it again.
Abduction.
Abduction is going to pull away, right? Abduct to take away. Adduction is going to pull in.
Yeah.
So it's going to have some forward flexion. So it's going to pull us more. I mean, if you think about it, if you pull here, it's going to pull in. If you go here, it's going to pull down. If you're here, it's going to pull across. So it depends on the position of the arm. But certainly helping with forward flexion, certainly helping with adduction in the horizontal plane. All right, biceps. We have this and this, which comes in to give us our bicep. And when you flex, you get a cool, like, oh, arms. And then that comes down below there. So we have biceps brachii, the main muscle that we have for for elbow flexion. What else does it do?
Supination.
So if it's in here,
Supination.
I'll zoom out a little bit. It's going to insert down to this point down in here. So it's going to give us strength in terms of supination. So if you're doing bicep curls, you can actually kind of overload the muscle. If you're doing bicep curls and you finish with a little bit of supination, you can actually put a little bit more stress on the muscle through that full range of motion. So part of your supination strength is from your biceps tendon. What else gives us biceps flexion? What else gives us elbow flexion?
That's it.
That's it. Brachyradialis, where's that one live?
Inserts the
On your arm.
It's home one of them bones down there.
styloid process.
So it comes off of this line right in through here, and it goes down right there on your radius.
Over here.
How do you remember this one? What makes this one easy to think about?
This?
It's your 12-ounce curls. So if you want to go hit a can of Coca-Cola, this is what's doing that for you. So that